We have to take the most decisive measures to curb the spread of the virus. We have to take coordinated efforts to mobilize medical resources and spare no efforts to treat the patients. We have to do a good job in nosocomial management. At the same time, we have to ensure the supplies and strengthen our efforts for the replenishment to make sure that we have sufficient supplies in the supermarkets, wet markets, and also we will provide better services to the salesperson for the wet market. And the wet market have to take the major responsibility to conduct disinfection and cleaning of their facilities. They have to pay attention to the details and make sure that all people entering into the wet market can get their body temperature checked. And to date, we have special guests from local authorities and Beijing CDC to attend this press conference, and they will also give us some update on the epidemic. First, I would like to give you an introduction about the speakers. With us today, we have the Deputy Director of the Emergency Center of China CDC and the expert of National Health Commission, Mr. Shi Guoqing, Mr. Wang Hongcun, Level 2 Inspector of Beijing Commerce Bureau, and Deputy Director of Beijing CDC, Madame Pang Xinhuo. First, I would like to give the floor to Madame Pang Xinhuo to give us updates on the new confirmed cases and the epidemiological investigation. Friends from the media, good evening. Now, I would like to give you an update on new confirmed cases on June the 15th. On June the 15th, from 0 hours to 24 hours, Beijing reported 27 new confirmed cases, including 70 men and 10 women. 3 are Beijing residents, and 24 are residents from other provinces, 22 in Fengtai, 2 in Mentougou, Dongcheng, Fangshan, Daxing, 1 case, respectively, and all of these cases are linked to Xinfadi market. Now I would like to give you more details about these cases. Case 1, 22-year-old man from Chongqing and lives in Huaxiang of Fengtai district. He works for a restaurant and he is the close contact of 1 confirmed case. He started to develop symptoms on June the 9th. And he was tested positive through large-scale screening. Based on the epidemiological history, CT scan, and blood result, he is identified as confirmed case with normal symptoms. Case 2, 21-year-old woman from Chongqing, and he lives in Huaxiang of Fengtai district. Also, she works for a restaurant. She is the close contact of 1 confirmed case and started to develop symptoms on June the 10th. And she tested positive through large-scale screening. Based on epidemiological history, CT scan, and blood results, she is identified as confirmed case with normal symptoms. Case 3, 37-year-old man from Chongqing, and he also lives in Huaxiang of Fengtai district. He is a chef. He used to purchase products from Xinfadi market and started to develop symptoms from June the 9th. And he is tested positive with the COVID-19 virus based on epidemiological history, CT scan, and blood test. And he is identified as confirmed case with normal symptoms. Case 4, 31-year-old woman from Chongqing, lives in Huaxiang of Fengtai district, also works for a restaurant. On June the 13th, she started to develop symptoms of coughing. On the 14th, she was transported to Tiantan Hospital with ambulance, and she is tested positive with COVID-19. Based on the epidemiological history, CT scan, and blood result, she is identified as confirmed case with normal symptoms. Case 5. 36-year-old man from Chongqing, also lives in Huaxiang of Fengtai district. Also, he works for a restaurant. He started to develop symptoms such as diarrhea on June the 12th, and he was transported to Tiantan Hospital with ambulance, and he is tested positive. And based on the epidemiological history, CT scan, and the blood test, he is identified as confirmed case with normal symptoms. Case 6, 30-year-old man from Chongqing, lives in Huaxiang of Fengtai district, also works for a restaurant. He started to develop symptoms on June the 13th and transported to Tiantan Hospital on the 14th of June. He was tested positive of COVID-19 virus based on the epidemiological history, CT scan, and the blood results. He is identified as confirmed case with mild symptoms. Case 7, 26-year-old man from Jiangsu province, lives in Mentong-Gou. He is actually the close contact of one of the confirmed case. He started to develop symptoms on June the 11th. He was tested positive through the large-scale screening based on epidemiological history, CT scan, and the blood test. He is identified as confirmed case with mild symptoms. Case 8, 39-year-old man from Hebei province, lives in Huaxiang of Fengtai district. He works for Xinfadi wholesale market. He tested positive in the virus through the large-scale screening based on the epidemiological history, CT scan, and blood results. He is identified as confirmed case with normal symptoms. Case 9, 49-year-old man from Henan province, lives in Huaxiang of Fengtai district, and he works for Xinfadi wholesale market. On June the 13th, he started to develop symptoms such as fever, and he was tested positive for the virus through the large-scale screening. Based on epidemiological history, his CT scan, and the blood result, he is identified as confirmed case with normal symptoms. Case 10, 52-year-old woman from Jiangxi, lives in Nanyuan of Fengtai district. She works for wholesale market of Xinfadi. She started to develop symptoms on June the 4th, and she tested positive through the large-scale screening based on the epidemiological history, CT scan, and the blood results. She is identified as confirmed case with normal symptoms. Case 11, 48-year-old man from Hebei province, lives in Huaxiang of Fengtai district, works for the Xinfadi wholesale market. He started to develop symptoms on June the 9th, such as coughing, and on the 14th of June, he was transported to a hospital, and based on the testing, the CT scan, blood results, and the epidemiological history, he is identified as confirmed case with severe symptoms. Case 12, 64-year-old man from Jiangsu province, lives in Huaxiang of Fengtai district. He works for Xinfadi wholesale market. He started to develop symptoms such as fever on June the 13th, and he was tested positive for the virus through the large-scale screening based on the epidemiological history, CT scan, and the blood result. He is identified as confirmed case with normal symptoms. Case 13, 41-year-old man from Shandong province, lives in Huaxiang of Fengtai district. He works for the Xinfadi market, and he was tested positive through the large-scale screening based on his epidemiological history, CT scan, and blood result. He is identified as confirmed case with normal symptoms. Next one, 26-year-old woman, and works for the Xinfadi wholesale market, lives in Huaxiang of Fengtai district, and she was tested positive through the large-scale screening based on the epidemiological history, CT scan, and blood result. She is identified as confirmed case with normal symptoms. Case 15, 61-year-old woman from Jilin Province lives in Huaxiang of Fengtai District. She works for Xinfadi wholesale market. She was tested positive through the large-scale screening. Based on her epidemiological history, CT scan, blood result, she is identified as confirmed case with normal symptoms. Case 16, 63-year-old man from Jilin Province lives in Huaxiang of Fengtai District. He works for Xinfadi wholesale market. He was tested positive through large-scale screening. Based on his epidemiological history, CT scan, and blood results, he is identified as confirmed case with normal symptoms. Case 17, 45-year-old man from Hebei Province lives in Huaxiang of Fengtai District. He works for Xinfadi wholesale market. He was tested positive in COVID-19 virus through the large-scale screening, and based on his epidemiological history, CT scan, and blood result, he is identified as confirmed cases with normal symptom. Case 18, 29-year-old woman from Anhui Province. She lives in Xinchun Street of Fengtai District. She also works for the Xinfadi wholesale market. She started to develop symptoms on the 9th of June. On the 14th of June, she was transported to Fengtai Zhongxi Hospital for treatment, and he was tested positive of COVID-19 virus. Based on her epidemiological history, CT scan, and blood result, she is identified as confirmed case with mild symptoms. Case 19, 39-year-old woman from Hebei Province. She lives in Daxing District. She used to pay a visit to Xinfadi wholesale market, and later on, she tested positive in the virus through the large-scale screening, and she started to develop symptoms on the 14th of June. Based on her epidemiological history, CT scan, and blood result, she is identified as confirmed case with normal symptoms. Case 20, 45-year-old man from Heilongjiang, and he lives in Fengtai Street of Fengtai District. He used to work for a restaurant, used to buy products from Xinfadi wholesale market. And she received NAT on June the 14th and tested positive in the virus. Based on his epidemiological history, CT scan, and blood test, he is identified as confirmed case with normal symptoms. Case 21, 28-year-old man from Hebei Province. He lives in Xinchun Street of Fengtai District, and he used to pay a visit to Xinfadi market from June the 5th to June the 11th, and he started to develop symptoms on June the 14th. He tested positive with NAT based on his epidemiological history, CT scan, blood result. He is identified as confirmed case with normal symptoms. Case 22, 64-year-old woman from Heilongjiang. She lives in Xinchun Street of Fengtai District. She used to buy products in Xinfadi market on June the 7th, and she started to develop symptoms on June the 12th. And based on his NAT, she tested positive in the virus. Based on her epidemiological history, CT scan, and the blood result, she is identified as confirmed case with normal symptoms. Case 23, 61-year-old man from Beijing, lives in Xinchun Street of Fengtai District. He used to visit Xinfadi market on June the 7th and hospitalized in Fengtai Hospital on June the 13th. He was tested positive of the virus. Based on his epidemiological history, CT scan, and the blood result, he is identified as confirmed case with normal symptoms. Case 24, 36-year-old woman from Guangdong province lives in Fangshan district. She paid a visit to Xinfadi market on June the 6th and started to develop symptoms on June the 12th, and she was hospitalized in Yangxiang Hospital. And based on her epidemiological history, CT scan, and the blood result, she is identified as confirmed case with normal symptoms. Case 25, 32-year-old man from Jiangsu province, lives in Mentougou district, and he used to pay a visit to Xinfadi wholesale market. He started to develop symptoms on June the 12th and visit the Mentougou hospital on the next day, and he is tested positive for the virus. Based on his epidemiological history, CT scan, and blood result, he is identified as confirmed case with mild symptoms. Case 26, 56-year-old man from Beijing, lives in Xinfadi district of Fengtai district. He paid a visit to Xinfadi market on the 6th of June and started to develop symptoms on the 7th of June. And later he was transferred to Tiantan Hospital and was tested positive. And based on his clinical evidence, blood result, and CT scan, he is identified as confirmed case with mild symptoms. Case 27, 65-year-old woman from Beijing, lives in Yongding Menwai Street of Dongcheng District. She used to pay a visit to Xinfadi on June the 8th and started to develop symptoms later on. And she was tested positive of the virus based on her epidemiological history, CT scan, and blood result. She is identified as confirmed case with normal symptoms. I will also want to give you some information about the two cases confirmed on June the 13th. The first one, 50-year-old man from Henan province, lives in Huaxiang of Fengtai district. He works for the Xinfadi wholesale market. He started to develop symptoms on June the 14th and went to Tiantan Hospital for treatment. He was tested positive for the virus, and based on his clinical evidence, he is identified as confirmed case with normal symptoms. The other case is 50-year-old man from Hebei province. He lives in Huaxiang of Fengtai district. He works for Xinfadi wholesale market. On June the 13th, he started to develop symptoms such as burning throat, and he went to Tiantan Hospital on the 16th of June and tested positive in the virus. Based on his epidemiological history, CT scan, and blood result, he is identified as confirmed case with normal symptoms. All of these confirmed cases are sent to designated hospitals for treatment. I would like to remind all of the residents, if you have ever visited Xinfadi wholesale markets, please avoid outside trips and report to your companies and local communities. Per arrangement of the communities, please receive nucleic acid test and mind your own protection, and please avoid gatherings and avoid dining together. Please wear a mask, and in places with poor ventilation, make sure that you wear a mask. And when you're taking the public transportation, make sure that you wear a mask. And please exercise 1 meter social distance with others. And make sure that you wash your hands frequently and keep a good ventilation. And please follow the regulation of Beijing municipal government and register your personal information and monitor your health condition in a timely manner. If you develop symptoms such as sore throat, fever, fatigue, and please seek for medical support in your nearby hospitals. That is my update. Thank you. Thank you. Now I would like to give the floor to Mr. Wang Hongchun to brief us on the situation about the market supply. Friends from the media, good evening. These days, we do see some fluctuation of the vegetable supply in the market. By taking this opportunity, I would like to inform you that we have restoring the order of offering vegetables in Beijing, and we have sufficient supply, and we have an impeded channel to provide vegetables to the markets. So now I would like to brief you some of the latest situation. Now we are continuing to improve the trading order in Xinfadi wholesale market. And on June the 13th, we have set up a temporary trading site in Xinfadi market. We have strengthened our management of the trading on site. By looking at the capacity, we can see that we have more agricultural products has been transported into the market. At the beginning, we could see we have over 300 transportation vehicles coming into the temporary trading site. And also in the temporary market, we also see some local vegetables. This means that for some of the traders, they are willing to visit the temporary market for the trading. And today, the trading volume is up to 2,100 tons. And second, we have unlocked the vitality of the supermarkets, and we have sufficient supply of the fruits and food. And for the chain stores, they are responding to our call and to provide support to different stores and vendors. And for Walmart, they started to provide support to the smaller size of the supermarkets. And they are also providing over 9 tons of vegetables and fruits to the small size of the supermarkets. And some of these supermarkets have made a commitment to the consumers that they will not increase the price to the consumers. For example, for Carrefour, they identified that for over 10 types of food will not increase their price. And for the majority of the daily necessities, the price has remained stable. Third, we'll do what we can to ensure the supply to the market. So for Xicheng district, they have activated the contingency plan. They have set up a temporary reserve center and also receive products from other provinces. In Chaoyang district, they also set up a new replenishment platform and to collect feedback from the supermarkets. And also they're guiding some of the supermarkets to make their replenishment in designated sites. For Haidian district, they are working with a relevant large size of supermarkets to provide food supply to close off communities which are surrounded by the Yuquandong market. And also a supply chain mechanism has been built up to support the secondary market and the chain stores so that all of these stores have sufficient supplies. And fourth, we will focus on the safety. At the same time, we'll also focus on the order of the market. The Commerce Bureau at district level has responded to the call of the Commerce Bureau. They also roll out thorough disinfection to restaurants, and all of this disinfection has been implemented in an orderly manner. And when doing the disinfection and all of these, restaurants are still open to the public and bring convenience to the residents. And going forward, we will continue to clarify our responsibilities and make sure that we can provide a point-to-point service for the replenishment of the goods to different types of supermarkets. By doing all of that, we can make sure that the daily necessities will be adequate for the market. Thank you. Thank you for your introduction. Next, I would like to give the floor to you. Please identify yourself before you raise the question. My question is to the NHC experts. Some people are actually now running the nucleic acid test. Some people are receive the result as a positive of the virus. Does that mean they are already confirmed cases of COVID-19? Can you tell us the difference of the asymptomatic cases and the confirmed cases? So now, Mr. Shi Guoqing, please take this question. Thank you for your question. By deciding whether a person was contracted with COVID-19, first we have to run nucleic acid tests to these people. If they're tested positive, we will say these people are infected. And among these people, if some of them, or after some time, they started to develop symptoms such as coughing, fatigue, or fever, we will say these people will be confirmed cases of COVID-19. For some patients, they may not have any symptoms. However, if we check their CT scan, if we found some pathological changes in their CT scan, these people will be also categorized as confirmed cases. For some people who are not have any symptoms and they do not have any changes in their CT scan, for these people, we will identify them as asymptomatic cases. So that is the major difference. However, for these two groups of people, they are all infected with COVID-19 virus. But we will treat them as equals and bring them into centralized quarantine. And also we will bring their close contacts into isolation and quarantine. Thank you. Next question, please. Thank you. From Beijing Daily. My question is also to Mr. Shi. Recently, salmon has been a very hot topic, and I would like to understand whether we can identify COVID-19 virus on the imported seafood. Does that mean if I eat salmon that I am contracted with the virus? Thank you for your question. Just like another food, if this kind of food is contaminated with virus, you may have a risk to get infected if you eat this kind of food. But now we do not have evidence to show that salmon is the host of the virus. But if you consider there may be a risk of exposure of the virus, or if you eat suspected food, you have to monitor your health condition and receive nucleic acid test. And this time, for certain places in Xinfadi wholesale market, we do found some places are contaminated. However, before salmon enter into the wholesale market, we have not yet identified any virus active on those salmon.
人民网、新华社客户端、视频专线、新华网北京频道、央视新闻客户端、央视财经客户端、中国网进行网络直播。
Actually, the live streaming is also available online through multiple media platforms or CCTV applications. This live streaming is also available in a couple of radio channels. You can also follow us at the BTV News channel. So thank you all the speakers and thank you for all the journalists. That's the end of the press conference. Thank you.